Good afternoon, everyone. We're very happy you're here. On behalf of my department, Critical Care, and the entire ICU multidisciplinary team, I'm very proud to be a sponsor of this event. I'm very delighted to see such a good turnout, and we're glad you're here. Now, as I'm speaking with you, imagine for a second I suddenly clutch my chest and tell you that I'm having severe chest pain. That pain is 10 out of 10. It's going down my left arm. I feel short of breath. I'm sweaty. I feel like I'm going to throw up. I suspect that most, if not all of you, would immediately think, oh, she might be having a heart attack. And I suspect that most, if not all, and hopefully some, would recognize the need for me to get immediate medical attention. Unfortunately, the signs and symptoms of sepsis are not that dramatic. They're very common to other illnesses, and it makes identification of a patient having sepsis very difficult. But the time to treatment of a patient with sepsis is crucial, just like in the patient having the heart attack. So we've got to do better at recognizing the signs and symptoms of this disease, and the disease is called a silent killer because of that. Now, our cancer patients, in particularly here, are very vulnerable to infection for many different reasons. The cancer in and of itself can weaken the immune system and the body's ability to fight infection. The chemotherapeutic drugs that we need to give patients in order to treat them also have the same effect. And then in order to give those treatments, we have to put lines in. Our patients have to have surgery, further increasing their risk of infection and then sepsis. In our department and in the ICU, we're committed to the fight against sepsis. We see it every day, we treat it every day. We follow evidence-based guidelines, and we've developed many programs of quality and safety, all aimed at taking care of the patient. But remember, time is of the essence, and if the patient has come to the ICU, that usually means that they're in shock, and we've lost a lot of window, and many times the patients don't survive. It's too late. Dr. Malik mentioned to you the Sepsis Collaborative. That's a very important component of what we do in critical care and in the ICU. It is led by Dr. Malik and Dr. Gaeta, and supported, of course, by our department and division. The goal is very simple. We want to decrease the mortality from sepsis, and specifically to increase our ability to identify those patients who in our ICU and before they come to the ICU may have sepsis. So early on when the group was getting together, they recognized the importance of taking this out of the ICU and to the entire institution. We knew that caregivers across the house, inpatient, outpatient, would all need to be engaged in this, and if the goal was going to be accomplished. The group received, of course, full endorsement from me, from Dr. Feely, my division head, but also from the senior leaders that you see in the front row. That's extremely important, because to get this information out, it can't just come from us. The education program that you see today, and some of the other programs that we've put together, they're crucial, and your presence here is great. It's great to see you all here, because programs such as this are extremely important in increasing our awareness of this disease, of understanding how we can prevent infection, of recognizing the early signs and symptoms, which is the key, again, very nonspecific. And we want to get to the point where it becomes so easily recognizable that the same sense of urgency, you know you have to treat that patient immediately, will be felt just like the patient that's having a heart attack. So with that, I'll turn it over to the other speakers. We hope you enjoy the program. Please feel free to ask questions after. I'll be around, and we're very glad you came. Thank you.
Thank you very much, Dr. Price. At this time, I'd like to invite Dr. Thomas Feely, Division Head for the Division of Anesthesiology and Critical Care.
Well, thank you, Dr. Malik, and thank you all for attending. I've been involved in critical care for just a little over 40 years now, and sepsis is one of those things that we've really not been able to get a good handle on. And I can remember some of the earliest patients that we treated in the ICU with septic shock. And over the years, there was always a sense of frustration in dealing with these patients, because by the time they ended up in the ICU, by the time they ended up needing life support with circulatory support, mechanical ventilation, pharmacologic therapy to support their circulation, the outcome was usually pretty poor. And so I'm really delighted to support the work that our team has been doing to try to get much earlier intervention, because I do believe that with earlier intervention, we can help many, many more patients not end up in that situation of being in the ICU. So thank you all for doing this. Imrana, Susan, Kristen, we really appreciate the work that you're all doing. So thank you.
Thank you so much, Dr. Feely. At this point, I'd like to invite Dr. Thomas Burke, our EVP and Physician-in-Chief, to share a few thoughts with us.
Well, I really want to congratulate the crew of the second movie. I thought they did a terrific job, so a great collection of actors. You know, as I saw this, I'm confused and drowsy on most days at work, so I'm wondering if somebody's going to pop into the office and get me started down to the emergency center. So I wanted to say a couple things. One is that nothing is worse than being cured of your cancer and then dying of a preventable complication that arises from your treatment or from your disease. And so our interest in focusing on early detection and management of sepsis is really to support the rest of the care team and the rest of the care programs that we provide to all of our patients. We have a very unique population of patients at extremely high risk of sepsis and whose immune systems are so blunted that they may not show the usual signs and symptoms that we might expect in a competent patient. And so for us to be more in tune to issues related to sepsis, I think is really critical. The other thing I wanted to say is that our intensive care team has been, I think, unique contributors to the institution in terms of taking on specifically targeted issues and finding ways to make them go away. And I would point to ventilator-associated pneumonias, line infections. We're working on urinary tract infections now, and I think sepsis is obviously a target for the group. And I never would have believed that we could have had the clinical impact in some of those other areas that we've been able to have. And so I think part of the stimulus of this kind of activity is to see if we can get to the same endpoint with a much more serious and significant event in our ICU than some of the other ones that we've been able to deal with very effectively. And finally, the greatest advertisement for hand washing would be the videos that you saw and the fact that the Joint Commission is likely to be here Monday morning. So this would be a really good time to have some hand gel as you walk out the door and advertise that particular effort. So Imran, I want to thank you for leading this for us as an organization, but to the entire team, the challenge is, so how can we go out and do some of these things and start to measure an impact that we have for the people we care for every day? Thanks much.
Thank you, Dr. Burke. At this point, I'd like to invite Dr. Oliver Bogler, Senior VP for Academic Affairs, and I wanted to mention that the videos that we watched were made courtesy of Dr. Bogler's support and would never have occurred if we didn't get his help to do that. And in fact, some of the skits that we'll have today, the prize money for those skits, for the winners, comes from Dr. Bogler's office as well. So we're extremely grateful for your help.
Well, thank you. I'm a little embarrassed now, but I want to just add my congratulations to Dr. Malik and Dr. Price for this fantastic program. You know, it resonates with me, I guess, in a few ways. One is that I, 3 months ago, completed my own active treatment for cancer here and can fully appreciate how many holes get poked into you during the day. It gave me a chance to see so many different parts of the institution as well, and all of our fantastic clinical teams. I didn't make a stop in the intensive care unit, maybe next time, but the other resonation for me is that this is World Sepsis Day, so I'm very engaged with our global outreach programs, and I really think it's fantastic that this problem, which is a problem everywhere cancer patients are treated, is being tackled in this very cooperative global way. And then the third thing is that I'm heavily engaged with the education mission at MD Anderson, one of our 4 mission areas. And I'm extraordinarily impressed and proud of your education efforts. Sepsis is one of those areas where education can be a big part of the answer, and I really commend you on the quality of your education programs. It's fun, it's effective, and I think it'll really hit the mark. So I'm just honored to be a part of this, and congratulations again. Thank you.
Thank you very much, Dr. Bogler. And then at this point, I'd like to invite Dr. Paul Mansfield, VP of Acute Care Services, to share with us his thoughts.
Thank you, Dr. Malik and Dr. Price. And I think this is really a great effort that you're putting forth on this. As Dr. Bogler mentioned, this is not just an MD Anderson problem, a Houston or Texas problem. This is a national and global problem. There's about 500,000 patients go to the EC every year with sepsis. It's about 10% of all deaths in this country are from sepsis. And our greatest weapon in trying to combat this is early detection and early intervention. As a surgeon, this has been probably the leading reason that I've lost patients after surgery, have been to sepsis. It is frustrating and it's devastating for their families. But there's things that we can do. As Dr. Bogler mentioned, we have a lot of patients on chemotherapy treatments, and these things cause people to be at greater risk for sepsis, and many of those patients end up in the emergency center. Dr. Terry Rice and her colleagues in the EC in the last year and a half to 2 years did a program of early goal-directed therapy, and what that resulted in was a 50% decrease in the mortality rate from sepsis. So there are things that we can do right here. I'd like to just mention on a personal note, unlike Oliver, I actually did come in here septic once a few years ago, and it was the rapid intervention of the people in the EC that prevented me from having to go to the ICU. Thank you.
Thank you, Dr. Mansfield. Now I know who to invite for next year to tell their story. At this point, I'd like to invite Dr. Laura Worth, Clinical Medical Director of the Division of Pediatrics.
We're very fortunate in pediatrics to have some very excellent nursing staff and clinical fellows. And we teach all our patients and their parents that a fever is an emergency and you need to come to the emergency room. And we're very lucky that we're able to have parents who intervene so quickly on behalf of their children. The difference also with children is that they just don't look right, and parents don't often know what that is, so they will bring them in, where an adult can sometimes convince themselves it's nothing. I know we also have a lot of residents on our floor who don't see fever and neutropenia as such an emergency, because I think it's because we start antibiotics so quickly that we're able to many times prevent sepsis from occurring. So we're delighted to be part of this endeavor, and I know when they tell you to wash your hands for about 20 seconds, does anyone know a good way to time that out? Yes? Oscar Mayer. We usually sing happy birthday. So if you're ever trying to teach someone to wash their hands and really figure out how long you need to wash your hands to get them clean, the happy birthday song works pretty well too, or we'll have to try the other one. So thank you for being involved in this, and we'd like to thank all the people who work with us to educate our patients and families and hopefully give them a safer future. Thank you.